Welcome and good afternoon or good morning, depending on your time zone, to this month's edition of Community Grand Rounds. Community Grand Rounds is hosted by the NARBA Institute, a not-for-profit public charity advancing well-being, and Health Choice of Arizona, a managed care organization, part of the Blue Cross Blue Shield of Arizona family of plans that is serving Arizonans on Medicaid or eligible for Medicaid and Medicare. I'm Mark Carroll with Health Choice of Arizona, and three brief items just to review with you before we launch today's rounds and introduce our speaker. The first is that all participants, so you are all muted, but we do encourage you to please use the Q&A function for any comments or questions during the course of today's rounds. We'll do our best to answer them at the time. If not, we'll respond to you afterwards. This session is recorded like previous Grand Rounds and will be available at the NARBA Institute website. And as you can see on the slide, we've listed our future presenters. We're fortunate in December to have Dr. Teresa Cullen from Pima County, and in January, Dr. Bob Wachter from the Department of Medicine at UCSF in California. Well, health, the word originates from Halen, the Old English word meaning whole. And I'm so pleased that we have Dr. Berwick with us. Don's insights remind me of the importance of our collective work in health and well-being, and the importance of that work focusing on both individual wholeness as well as wholeness of our communities and, dare I say, our society. They also remind me personally, especially at this time of year, that while I have the opportunity to give thanks for the many blessings which I'm fortunate to have in my life, it's also important for me to be thankful for the opportunity to give. So while giving thanks, I'm also thankful for the opportunity for me to give as myself and collaboratively and collectively with you to work together to improve the health and well-being of all our patients and all the communities we serve. So to introduce Dr. Berwick today and help our rounds launch, I'll introduce and turn the podium over virtually to my mentor and very good friend, Mary Jo Gregory, President and CEO of the NARBA Institute. Mary Jo?
Thank you, Mark. And thank you for reminding us all to be grateful. That's a lovely thought to start our day today. It is my true privilege and gift to introduce Dr. Don Berwick. I'm sure all of you are aware that Don has a CV that is quite remarkable, but the most profound part and gift that I'd like to illuminate today about Don is that he really is a key giver in this world and possesses such generous resiliency, especially in this time that we're all living through. I'm kind of reminded of Charles Dickens, you know, it was the worst of times, the best of times, and an age of wisdom. And perhaps that is kind of a framing for today. There are awful things going on in terms of the COVID-19 and the impact it's had on our country and on the world. But if we want to look at the positive end, maybe it is the best of times in terms of being able to share this wisdom. And so Don has a long, long history. Many of you are very aware of his brilliant career. But this gracious resiliency, I think, is one that maybe is a gift and a template that we can all learn from. As we all know, Don is in Boston at Harvard and led the IHI himself for many years. Those of us that know Boston know that it is a wonderful place for medicine, wonderful place to learn. However, sometimes not the most welcoming for change. And one of the things that Don did from the beginning was help us understand patient safety and that resiliency of being gracious, but being able to serve up opportunities for improvement really have made just a sea change in terms of how we look at medicine and healthcare today. And it's within that I think his keynote on the moral determinants of health is so vividly important today, probably more so than it was several months ago. And so it is such a gift and privilege to have you with us, Don. Thank you very much. We're happy to have you here. Don has offered to make opening comments for us. Then we're going to watch his keynote. And Mark and I will try and guide this through. But again, very grateful to have you today. Thank you.
Thank you, Mark and Mary Jo. Let me just check that you can hear me okay.
Yes.
Well, it's a privilege to get to join you, and extremely flattering that you would choose to show my keynote address from the IHI National Forum from last year. And I feel lucky to get to make a few opening remarks. The speech you're about to see was given a year ago in December of 2019. At that point, nobody knew about COVID. We weren't in the midst of a pandemic, and so much has changed now. I'll be giving the keynote address again at the IHI National Forum coming up in just 2 weeks. I'll do a little advertisement. I hope some of you listening will decide to join the forum. It's December 6th through 9th, but it's all virtual now, and we have a tremendous lineup of speakers and workshops, and you can get to participate without leaving your chair. But it's totally earthquake has happened, and we are now living with and trying to survive through this pandemic. And I guess it seems to me that the messages I was trying to convey last year, maybe even more important to me this year. COVID has so strongly underlined some of the challenges that I was trying to address in the talk that you're gonna see on moral determinants. I thought I could give you just a little bit of background to that talk. It'll give you a context for where it was coming from and then how it applies to COVID. So, my career, as Mary Jo said, has been devoted to trying to improve care, patient safety, effectiveness of care, patient centeredness, timeliness, efficiency, equity, trying to make care better all over the world. I've worked in dozens and dozens of countries. I've been so privileged to do that, first as the founding chief executive officer of IHI, and now as a senior fellow there. It's been a wonderful experience just to improve care. What we do in healthcare is noble. It's very important. And when and if I fall ill or have a behavioral health issue or just want to be reassured about my health, I need a healthcare system that has a total commitment to excellence. And IHI's existed to make that happen. I have to mention that among IHI's programs has been the Leadership Alliance, which is a collection of 50 organizations, there are 55 that have come together to advance that agenda. NARPA just joined, and I'm just so thrilled to have you as a formal partner in IHI. But the Leadership Alliance didn't form just to make healthcare better. It formed to achieve the triple aim, which was first articulated by my close colleagues and friends, John Whittington and Tom Nolan. A word about Tom. Tom was my mentor for decades, one of the most brilliant, generous scholars I've ever known. He died last year, or 2 years ago now, a year and a half. And but Tom and John, after the articulation of the agenda of quality improvement, came to me in IHI and said, that's not quite right. Just making care better isn't enough. Healthcare is a repair shop. We fix things that are broken, but they got broken somewhere else. Threats to health come in our communities, in our lives, the so-called social determinants of health. That's what makes us healthy or not. Healthcare actually doesn't very much produce health at all, tiny little bit. The real generators of health lie in the way we treat our children, birthing experiences, our education systems, our housing, our workplaces, our elder care, transportation systems, food security, violence, prevention, criminal justice. These ambient circumstances are what create health. And so they set out the triple aim: better care for individuals, but also better health for populations. That's the second. And the third arm was reducing per capita costs, saving resources, because there's lots of other very important uses for resources beyond healthcare. And healthcare doesn't have an entitlement to its money. It competes in its good work with other good works in education and the arts and even corporate success. The ability to pay wage workers not just a living wage, but better than that. And so they said the triple aim has to be adopted: better care, better health, and lower costs, which turned my attention to that better health piece. Well, what is that about? And I became, for a number of years, a student of the generators of health, social determinants. Turns out it's a massive literature, which many of you may know. Certainly Mark, having worked in Native American communities, understands how important community is to the generation of health. It's not you can get the best health care in the world, but if the community isn't health giving, it's hard to be healthy. So I became a scholar, I guess I'd say a student of that, and was very impressed by the power of social determinants. In the speech, you'll hear much more about that. But then came a paradox, a kind of confusing realization to me in the past few years. Why do we not work on the social determinants with the vigor and energy and investment that we do on healthcare? What is it about healthcare that attracts so much energy, gravitas, money, professional attention? But when you look at these other things like the status of young children and the robustness of community infrastructures, food security, housing security, when you look at our criminal justice system and other elements of disease generation, why are we not working on that? That's a serious question because the science points there very clearly. And it got me interested in, I guess, an exploration of motivation. What would make us do that? Economics? Apparently not. I mean, it is true that it's sort of smart economically to work on health, but the immediate returns to investment that occur in the healthcare side are so much more than you get by working, say, on food security right now, that economics don't appear to drive it. Politics, we're divided right now. Our politics are not supportive of coming together to solve social problems. We're too angry at each other. We too divisive. And so we can't generate the communitarian effort that would take to have no hungry people in America, or to fix our criminal justice system, or to have health generating communities. As one searches for motivation, it's hard to find it. And that led me to the speech you're about to hear, which is called The Moral Determinants of Health. And it's a relatively high-minded and almost arrogant viewpoint, but it's an honest one, which is, I don't think we have the energy to work on what matters to health unless we check our moral compass. I think it's going to have to come from something like the moral compass within. In the speech, I quote Immanuel Kant, who, by the way, turns out to have been a terrible racist, misogynist, who's not a very good model for solidarity, but a philosopher of merit. And Kant said, two things fill me with awe: the starry skies above and the moral law within. And that moral law is what I begin to refer to in the speech. It takes you odd places, because you'll see in this speech, I'm talking about the kinds of engagement with social determinants of health, very, very broadly writ. And it just is where the logic carries you if what we're after is health and well-being. Then comes COVID, and it kind of like puts a megaphone on everything I just said. COVID is certainly about bioscience and better care. We need people well dealt with on respirators, and we need a vaccine, and we need treatments and remdesivir where it counts, and so on. But that's the health care part. The rest of it, the inequity we see, the ratio of deaths in African Americans or Native Americans or Latinos to whites, 4-to-1, 5-to-1 rates of death for Native Americans and African Americans, the dislocations in our society we're seeing, the unemployment, the soaring poverty, not just in the US, but all over the world, the hunger. There are 40 million hungry people in America tonight. And that's partly due to this pandemic, but it was always with us, this burden, and we've got to find the energy to address it. So the speech is a challenge. It's based on science, but it brings us to the brink of some very tough decisions about where we as a society put our resources and what we care about, and where we as a healthcare community put our energies. Because my argument in the speech is we can't stand aside. There's no free pass here. We can't just keep working in our healthcare world claiming to be healers when the generators of the illnesses we are treating lie in society that we have to engage with also. That's an uncomfortable ask, maybe especially so in the midst of COVID, when our healthcare givers are exhausted just dealing with the behavioral and with the mental health and physical health consequences of the pandemic. But It's a bridge I think we have to cross. You may end up after the speech disagreeing with me. You may say, nope, that's too big an ask, but it is the ask. I say, you know, I didn't enter healthcare to solve social problems, but now that we look at the science, what I say, the job got bigger and the challenge is real. So that's what's behind it. Hope you enjoy the talk, and if you disagree, let's talk further. Thanks.
Yeah, thank you so much for those introductory comments, for the work. And I would say, if I may, not an arrogance to have stood up in front of thousands of folks last year and offered that presentation, but the courage to do that and the courage to speak both your personal as well as your professional truth, yet leave space for folks to have differences and engage in a conversation. Don, what's the role of kindness? We sometimes in Arizona talk about kindness spreading faster than COVID. From your perspective, where does just basic human kindness and decency fit into the framework that you've laid out?
Oh, Mark,
that's a big question. I'm sorry.
No, it's fine. I think that's all it is. You know, Avedis Donabedian, the great scholar of quality of the last century, as he was dying, had a famous interview with Fitzhugh Mullen, in which is widely repeated in our field. And what he said was, the secret of quality is love. And that sounded a little flaky or soft, maybe. He was absolutely right. It has to do with this moral determinism arguing for. I don't know where to find the energy to work on suffering, except from a space of kindness and generosity. There's no other way. The good news is maybe that binds us. Maybe, I mean, look, I'm in as blue a state as you could get. I'm a pretty left-wing politically. And I look at the map of the US with red places. I don't think they're less kind. I think something else we just haven't been able to build that bridge. So Mark, I think that's all it is. You know, it's funny, I just took this off I have a passing interest in Buddhist philosophy. I'm not a religious person, but I get emails that this just came. This is from one of the places I sometimes look for study. It's a Zen meal, a prayer, I guess, or it's a acknowledgement at a meal in the Zen tradition. Here's what it says. It says, "We receive this food in gratitude from all beings who helped to bring it to our table, and vow to respond in turn to those in need with wisdom and compassion." You know, to celebrate the good luck we have, and then to respond in turn to those in need with wisdom and compassion. I just don't know another way, Mark. I don't think the economics are going to do it. And right now the politics aren't. So it's going to have to be some other source of energy. And we'll have to count on it.
Thank you. I've sometimes very loosely used the analogy of the triple aim that you and colleagues have so nicely articulated, which, by the way, has just been foundational, I think, to the work, not just of improvement, but thinking about health of communities in a very different way. But I used to use an analogy of the heart, the head, and the wallet, and that they're all part of us. And we just have to know which part is speaking at a given time. But that's part of our integrated approach.
I love that. I'll use it with permission. Thank you.
It's such a joy to speak with you, Mary Jo. I should allow time. Anything that you'd like to ask Don while we have a few moments?
Well, I've known him for a very, very long time and have admired with great gift of and treasure of medicine. And the only thing I would ask you, Don, is have you seen since COVID, you mentioned the challenge, is there any specific areas that seem to be more of a challenge than pre-COVID? We're certainly talking about, basics, food insecurity, those kind of things. we work many in the area of anxiety, and in places like that, we're doing a lot of work on healthcare worker well-being. And any comments in that space that you think are important for us before we go to the talk?
Yeah, well, you've mentioned one important one, which is my colleague Nikki Lurie, former Assistant Secretary for Preparedness Response, taught me. She said, in every disaster, there are two disasters. There's the disaster itself, and then the psychological, mental health, behavioral consequences of it. And boy, do we see that. I mean, just start with the workforce, which is at the, doing their best, but they're suffering. I mean, our workforce is just exhausted and scared and not always feeling supported. Also courageous and coming together and doing the work that needs to be done. I mean, people are just reaching in and doing it, but let's not underestimate the toll this takes on the workforce. And the workforce, remember, is not at all just physicians or physicians and nurses. It's everyone engaged in trying to reach out help to people who are in trouble, disease and otherwise. I guess more generally, the behavioral health implications of COVID are now becoming clear. The mental health burdens in society. There was just an article in the paper yesterday about a series of teenagers having committed suicide. These are kids who just they aren't making it in the education disarray we have right now, and suddenly kids who were barely hanging on find themselves lonely and isolated. And so maybe the whole behavioral health agenda has become just so much more vivid. We have the downstream economic impact. I mean, before this Zoom, I was on I'm on a committee in Wales trying to figure out what to do in the country of Wales with the COVID pandemic, and they are anticipating the downstream effects now on the economy, unemployment, waiting lists, and the backlog that's building up, and it will in every nation. The poverty increases that COVID has brought us through unemployment and other mechanisms we're going to have to deal with this, and it is health related, of course, because poverty and wellness have trouble coexisting. So yeah, we've got a big challenge. And back to Mark's question, which is, these are so big. These problems are so big. This is, we say in IHI, all together or not at all. And I think these have that. This isn't the win-lose game. Nope. The only thing to beat right now is that virus, and not each other. And coming together is going to be crucial.
Yeah, a game of commitment and a journey together.
Yes.
Hopefully making some destination points, but always understanding that we're moving forward.
Yes, and maybe a piece of that is science also. That's the heart, the head, and the wallet. The head part is, let's deal with science. Let's use the intelligence that human beings can bring to this with discipline and with trust and with constant learning, so that when we are compassionate, we're being compassionate with the methods and mechanisms that we can count on. And that's part of the solution too.
Well, we look forward to continuing to learn with you, but we're especially thankful for the role of teacher and mentor that you have and continue to play. So please keep mentoring, but we're so appreciative of you taking the time today to spend with us. Hopefully the time in the future to help us connect to some of these best practice resources, groups, and collaborations, so that we can all learn together. Our country has a road of healing ahead, and that's gonna have to reach down to the most remote of communities that we serve and that we need to care about, and we do care about. So thank you so much, Dr. Berwick.
It's a privilege. Hope you enjoy the video, and I look forward to feedback as people react to it later on. Thank you so much.
Thank you. Have an excellent Thanksgiving.
Nice Thanksgiving.
Thank you for joining us.
The quality of mercy is not strained. It droppeth as the gentle rain from heaven upon the place beneath. So says Portia in Act 4, Scene 1 of Shakespeare's Merchant of Venice. I've got to say the world seems a little bit parched of that gentle reign of mercy nowadays to me. But mercy persists, and you can find it. You find it on the small scale and the large scale. You see much of it represented here. Let me celebrate some kindnesses, for example. Take Evan, for example. I'm fond, as you know, of talking about my grandchildren. They teach me. I've got 7 grandchildren now. Everybody lives in Boston, within a few miles of my home, and this is Evan. He's grandchild number 3 of 7. That's his age ranking, not his quality ranking. Be careful. And I guess today is Evan's lesson for us all. He's now 5 years old. A year or two ago, somewhat after Donald Trump was elected, Evan was riding in his car seat, in the back seat, and he asked his mother, Beth, a question. He said, "Mama, do you think that Donald Trump is happy?" So Beth paused for a minute, she said, "No, Evan. I think Donald Trump is sad." And a minute later, she looked in the rearview mirror, and there was Evan waving a breadstick in the air above his head. And so she said, "Evan, what are you doing?" And Evan said, "This is my magic wand. I'm trying to make Donald Trump happy." Here's another little story of mercy. I had lunch one day a few months ago in a restaurant near our offices in Boston. I was walking back up the hill toward my office. It was a very hot day, and I saw this young guy, a waiter, dart out of the restaurant that I just left and run up the hill, top speed, after me. He was waving something, and he got to me. He was sweaty, he was out of breath, and he handed me my own notebook. He said, "You left this at your table, sir, and I thought you might need it." Mercy comes in big packages also. For example, in the Marais district in Paris, there's a small street, it's an alley, which is now called l'Allée des Justes, the pathway of the righteous. There is a wall engraved with the names of 3,853 French people. They are honored there by the Israeli Holocaust Memorial Organization, the Yad Vashem Memorial Museum, for their courage. Here's what the plaque on the wall says in part. It says, "At the risk of their own lives, alone or in organized groups, these men and women from all political and religious and social backgrounds overcame the indifference that seemed to hold sway in our land and rejected barbarity. They felt a sense of commitment and responsibility toward their fellow human beings. These righteous in providing moral and material support, hiding places, identity papers, food, and escape routes, helped 3/4 of the Jews in France survive the persecutions of the Vichy government and the Nazi occupiers." Arthur Kleinman, a colleague of mine at Harvard, by the way, has just published a book, and he describes caring for his own wife. It's called The Soul of Care. You should read it. He says in that, caring is what is morally and emotionally most at stake in human experience. It is what makes life worth living. From the time that I first met the basics of modern thinking about quality, under the tutelage of people like Tom, I had a vague feeling, it's a disconcerting feeling about this field, about quality improvement, the field that's now taken up over 30 years of my professional life. And here's the deal. You see, the roots of improvement are technical. They lie in the quantitative sciences of systems and statistics. But quality improvement has other roots too, I think, deeper roots. Roots in something much more philosophical, something emotional, something spiritual. It can't be an accident, I've thought, that two of the leading intellects of the past century in the field of quality came late in their lives to some very close related reflections. One is Avedis Donabedian. In his last published interview, 1 month before his death, as I'm sure you've heard before, Avedis, the dean of a half century's research on healthcare quality, he famously said, ultimately the secret of quality is love. You have to love your patient, he said. You have to love your profession. You have to love your God. And W. Edwards Deming, whose theories for improvement still to me are second to none in their technical mastery, he wrote, "All anyone asks for is a chance to work with pride." So Evan, in his breadstick magic wand, and that breathless, anonymous waiter running up the hill after me on a very hot day, and the righteous of France, they have something in common. Kindness, mercy. Each in his or her own way, at their own age, in their own place, is using their energy to help. And this is really important. Each of them chooses to help without the slightest expectation of reward. They don't even want a reward. Evan was waving his wand in the privacy of his backseat car seat, paying that waiter for his kindness in running up the hill after me. I think that would have been an insult. That's how he would have felt it. And Les Justes risked much, much more than they could possibly gain. They risked their lives. So people fret about the definition of the word quality. I don't. Long ago, I had personally adopted a very simple definition of quality. It's never let me down. Quality is simply the degree to which the work you do and the results of that work match the need that you set out to meet. That has it all for me. If you miss the need, that's defect. If you meet the need, that's quality. End of story. Needs, of course, are not singular. They're complex. I need my car to be safe, fuel efficient, economical, durable, easy to fix, fun to drive. Healthcare needs care to be safe, effective, patient-centered, timely, efficient, equitable. Quality, by the way, it's actually the wrong word. We actually should be talking about qualities. That's the right word, because it's dimensional. And the needs aren't stable. They vary. They vary among people. Your needs are not necessarily my needs. That's why we inquire what matters to you. It varies among places. A rural village is not the same as a crowded city. And they vary over time. People once needed snuff and horse barns, and now most of them don't. Now, nobody tells you what need to try to meet. Nobody. That's your choice. Once you choose the need you intend to meet, then you become a servant, because that choice is going to tell you what you then have to do. It'll tell you how and where to apply your efforts. But your aim is your boss. So if you want to make music, your aim, you find the piano. If you want to create scientific knowledge, go to a laboratory. If you want to rob banks, find a bank. When the righteous of France chose to help their Jewish neighbors, their work then was defined, and it's summarized on the memorial plaque. Remember, it says providing moral and material support, hiding places, identity papers, food, and escape routes. Their aims define the system of work. Lucky for Evan, all he needs is a breadstick, a magic one. The waiter needed good legs, and I assume a forgiving supervisor. What amazes me, it's a kind of mystery, is how often pursuing quality, the match between your work and the needs you intend to meet, at least in healthcare, it invokes aims that I can only call righteous aims, good aims, noble aims. We are called to heal. We are called to reduce suffering and to prevent injury and to ease passing. Those are the needs we choose to meet. Why do we choose? I honestly don't know. I don't know. No one ever ordered me to try to heal other people. I just chose to do it. It just seems right to try to do that. I don't have any deeper explanation than that. And that gives me, in me, the rise to that vague unease that I always have about treating quality improvement as purely, mainly technical. Is it possible that the pursuit of improvement, better meeting needs, better matching our work to the needs that we intend to meet, is actually spiritual enterprise. Is it possible that quality and ethics are close relatives? The essence of quality has to do essentially with the essence of morality because of the choices we make. In other words, it's not just the quality of mercy, it's the mercy of quality. There's some science here. I could spend the rest of my time on the sciences that surround issues of compassion and kindness and generosity. It's deep. I'll give you a small example of this playing out. I had the really good luck recently to be in Birmingham, England. I met a young pediatric intensive care doctor there. His name is Adrian Plunkett. He has helped, and I think it was his own initiative, to develop a very clever project at Birmingham Children's Hospital. It's called Learning from Excellence, LFE. The well-developed safety reporting system at the hospital was about, of course, about defects, about unsafe stuff, things that went wrong. But Adrian began wondering about the opposite of that, about good things, about excellence, actually from a personal experience he had as a patient, where someone rescued him. And he created a form to report on that. Positive reports, just like they would if they were negative, the positive reports go instantly to the people involved so they can celebrate what they did. And then the organization does appreciative inquiry on what went right. If you're a student of the safety world, you'll recognize here in Adrian's innovation, so-called Safety 2 paradigm that Derek has mentioned in prior speeches here. It was introduced by Jeff Braithwaite and Eric Holnagel. It's a complement to Safety 1. So Safety 1 focuses on errors, Safety 2 studies successes. And the results in Adrian's project are very encouraging. 93% of the staff surveyed at that hospital, Birmingham Children's, agree or strongly agree that learning from excellence, that program improves staff morale. 85% think it improved the quality of care. Could it be that Deming is right, that all anyone asks for is a chance to work with pride? I will do a little commercial here. Learning from excellence has spread. It's both within Birmingham Children's Hospital, now to other hospitals, and I think it should be universal. I urge you to check out their website. So now let me give you a spoiler alert. I'm about to wend down a path here, and I think I'm about to lose some of you. Right about now. I think I'm going to run afoul of your beliefs about boundaries that you think I shouldn't cross. Some of you are going to think I'm out of order, that I'm going to get too political right now. Some of you are going to walk out. I really think so. Before I'm done. I wish you would not walk out, but I can't stop you, but I can't stop myself. I can't help myself because I feel what I'm about to share with you too strongly. And the path takes us down to the dark side. So Portia in her lecture about the quality of mercy, she's lecturing the usurer, Shylock. Shylock was a Jew. He's a caricature of a Jew. He's based on the anti-Semitism that was very widespread in Elizabethan England at the time. Portia, the champion of mercy, whether consciously or inadvertently, was a bigot. When you face the wall of names of Les Justes on l'Allée des Justes, if you turn around 180 degrees, you'll realize that your back has been to the door of a school, l'École des Garçons. From the neighborhood of that school in the years of World War II, more than 500 French children began their deportations to death in Nazi concentration camps, just from that neighborhood. 76,000 Jews were deported from France. 11,400 of them were children. 6,184 were children from Paris. Les Justes had enemies. Our nation has been a beacon of democracy, of kindness, a refuge to some. You know, give me, you're tired, you're poor, you're huddled masses yearning to be free. But our real story is much darker. In a masterful and very disturbing book, These Truths, historian Gilles Lepore retells American history from the viewpoint of the people we exploited, blacks, immigrants, Native Americans, women, and more. We have a vicious history of slavery at our roots, and the legacy of that damage is with us today. Between the end of Reconstruction in 1877 and 1950, my lifetime, the Equal Justice Institute counts 4,084 racial terror lynchings in 12 southern states and 300 more in other states. In the late 1940s, Thurgood Marshall, the black attorney who successfully argued the case of Brown versus Board of Education and who later became a U.S. Supreme Court justice, Marshall was not allowed to eat in many of the cafeterias of the federal courthouses in which he argued his cases. In 1955, in 8 southern states, in 1955, not one single black child was going to school with a white child. And now, today, look at what's happening in our nation. The past 3 years have witnessed forced separation of parents and young children by our government at our southern border. White supremacists have marched in some of our cities with hardly a word of censure by some of our nation's highest leaders. The safety net programs for our most impoverished citizens, disproportionately, but by no means only people of color, white people get affected too, have been systematically and cruelly cut. Just 2 weeks ago, a process to begin to take 700,000 Americans off food stamps. We've cut housing subsidies. We've cut medical care access. Incarceration rates have risen. And assistance to people returning from prison has been reduced. And on the world's stage, our country's once proud, once vaunted leadership in helping the poorest nations and the poorest people on earth has steadily been eroding. We are withdrawing from the Paris Climate Accord, humanity's effort to work together to save the planet from the ravages of climate change. Generosity gives way to self-interest, openness gives way to fences, and human solidarity gives way to tribalism. And the results are devastating. In New York City today, over 114,000 school children are homeless. It's a record high. 1 out of every 10 kids in the New York public school system lacks a home. There are more homeless kids in New York City today than the entire population of Albany, New York. In 144 of New York's 1,800 schools, more than 1/3 of the students are homeless. And what are we doing about it? New York schools have 1 social worker for every 1,660 homeless students. The consequences of our weakening resolve toward an American social safety net they're just too apparent. As Kate Armonte mentioned early in the forum, just 2 weeks ago, Professor Stephen Woolf and his colleagues published a landmark analysis in JAMA of the unprecedented turning point in American life expectancy that we have witnessed since 2013. For the first time in my lifetime, life expectancy is falling in this nation, mainly for adults between 25 and 64 years of age. The effect is concentrated in what the Nobelist Angus Deaton and his colleague Ann Case called deaths of despair, mortality from alcoholism, drug overdose, and suicide. You can see the inflection here, the soaring rate of death from just those causes, but it's not just those causes. More and more people are giving up, feeling abandoned, without hope. Now, I'm speaking today primarily about the United States, but let me be clear, there are 53 countries represented in this room right now. These threats to compassion and to decency, they're not confined to the United States by no means. There are fearsome vibrations of isolationism, meanness of spirit that are being felt in all too many nations around the world today. If you're in this audience and you're not from the US, I'm going to have to leave it to you to see what fits and what doesn't, because I'll just be talking primarily about the US context right now. In July 2018, we saw another consequence of this in our industry. A Harvard surgeon, Simon Talbot, and his psychiatrist colleague, Wendy Dean, they published an essay, and this essay immediately trended on social media. It spread like wildfire. They labeled one consequence of the loss of connection to mission among physicians. They call it moral injury. They say, failing to consistently meet patients' needs has a profound impact on physician well-being. This is the crux of consequent moral injury. We could say the same about other health professionals. So the contrast between the human bias toward mercy and the ugliness of so many past and current behaviors, it's very hard to understand for me. It's impossible to reconcile. Here's Evan waving his magic wand to create happiness. That's his instinct. But other people, including people in power, they systematically and intentionally increase human suffering. That waiter didn't have to. He runs up a hill to help me, but others systematically and intentionally stop helping. The righteous, they risk their lives for strangers. Others risk nothing. They ridicule the unfortunate. They turn their backs on need. They take and they take and they take. And shall we stand for that? If the quality movement, if our movement draws purpose and energy from the instinct to help, which is a choice, if we choose to commit to close the gap between the work we do and the needs we intend to meet, can we stay silent in the face of damage to a compassionate society? I know that's a difficult question. I know it risks a Manichaean posture. It conjures up some battle between the forces of good and the forces of evil. And I also know that's not quite right. It can't be right, because some of the harm that I hate, it's coming from the actions or the inactions of people whom I do value and respect, but I do not understand why they do what they do. And my hand is forced by my heart. I can't tolerate in silence the creation of suffering, even by people whom I otherwise respect. For me, the pursuit of improved quality does not float morally free. For me, it must be moored to values and ideas. It has to be moored, above all, to respect for human rights and human dignity and human solidarity. The pursuit of quality, for me, it is incompatible with intentional harm to vulnerable people. It is incompatible with the destruction of our shared environment, with the destruction of our planet. It is incompatible with being at peace with poverty or simply accepting a viciously unequal world with starvation right alongside gluttony. It's incompatible with racism. It's incompatible with fear of each other. It's incompatible with greed or injustice or exclusion. Now, I didn't ask for this when I began my journey to try to improve healthcare, and I'll bet you didn't either. But now, I guess as I age, I simply cannot deny what I feel, which is that our movement has reached an inflection point in which we who claim to embrace the continual improvement of human health and human well-being, we cannot turn our backs on the ethical and moral dimension of that calling. We are not just technicians, we are defenders of human well-being. Suppose we were to draft a manifesto on that inescapable connection between quality and mercy. What would it say? I know what it would say. It would say that intentional harm is an enemy we do not have the right to ignore, that there is no quality without compassion, there is no quality without justice, there is no quality without inclusion, and that we have a duty to to protect the commons, what we hold together. And it isn't enough merely to bear witness. We have to act. Cruelty, injustice, and exclusion are wrong, and I think we need to find the courage, the voice, to call what is right, right, and to call what is wrong, wrong. The search for a foundation for a position like that, a foundation for determining what's right, it's probably been the central project of philosophers for millennia. For Aristotle, policies were right if they assured for everyone and everything situations that accorded with their true nature. Problem is, who says what's the true nature? For Jeremy Bentham and John Stuart Mill, the founders of utilitarianism, what served the greatest good for the greatest number was right, even if minorities lost out. For libertarians, individual human freedom of action is the first principle of justice, and property rights are sacrosanct. Immanuel Kant believed that actions are right only that come from respect for individuals as ends, not means. He would have hated the term human resources or human capital. For Rawls, people are not means, they are ends. And John Rawls, who is the modern heir to Kant, he argued that the proper foundation for right policy is to decide on rules from behind what he called a veil of ignorance, in which one decides as if he or she could not know her position or his position in the population. What rules would you make if you did not know? What rules would you make if you did not yet know and couldn't know what your race would be, or your wealth, or your gender, or your ethnicity, or your family background? That's Rawls' rule. I find myself in tune with Rawls. For reasons that I can't understand, what seems right to me is some amalgam of that idea of respect for every single individual as an end, not a means, on the one hand, but combined with some sense of solidarity, a feeling that we are, as human beings, fundamentally all in this together, and that we have to depend on each other or we are all lost. I'm intrigued, by the way, by the work of one of the foremost American philosophers of our time, Professor Martha Nussbaum from Chicago. Professor Nussbaum unapologetically calls upon mercy as a fundamental resource for a just society. She's written 24 books, so it's hard to know everything she said, but she goes farther, I know, because in her 2013 book, Political Emotions, the subtitle is Why Love Matters for Justice. She writes, all the core emotions that sustain a decent society have their roots in or are forms of love. I'm reminded, by the way, of the IHI's choice in its 4 core values, which are courage, trust, equity, and love. Now, it's perfectly understandable if what I'm contending alarms you. The quality of mercy may not be strained, but assuring mercy, it's a really heavy lift, because the assault on mercy is really large, especially now. Its manifestations are everywhere. And even to begin to suggest that we need to take on harm in all of these costumes is exhausting. And I know you want to say, we can't do everything. I know we can't. But I want to offer an analogy, and it's sort of slippery, but what the heck. Okay, so imagine a hospital. The hospital's very busy, way beyond its comfort, very, very tired. And for its own health, the hospital leaders decide they have to cut back. And so the hospital announces, we realize we can't do everything. So starting on Tuesday, we're going to treat ailments only on the right side of your body, not on the left side. If you're sick on your left side, you are out of luck, but it's not our problem. Sorry, no margin, no mission, right? Well, it wouldn't go down very well. Not to me. You'd say, well, hold on a minute. You just can't walk away. Hospitals can't do that. You can't treat half a person. You have to treat the whole person. That's what being a hospital means. It's on those exactly same grounds that in my plenary talk here last year that I argued that the so-called social determinants of health, the upstream things that cause our heart attacks and our broken arms and our depression, that the foods we eat, patterns of exercise, smoking, racism, so on, that these are so powerful that it's just not logical for the healthcare enterprise to sign off. It would be like saying we don't treat the right side of the body. If we're purport to heal, then we just don't get to say that's society's problem. That's not what we do. With healthcare confiscating 1/6 of our economy, I argued then, we shouldn't claim the privilege of not changing those determinants. We shouldn't claim the right to say we don't do hunger, we don't do homelessness, we don't act against violence or racism. If it threatens our current business models, that isn't sufficient reason to walk away. It is sufficient reason to change our current business models. This is a matter of quality, the degree of match between our work and our needs, our work and the needs that we choose to intend to meet. We choose to help health, so help. So just when you thought it was safe to come back to the forum, here I am. I'm going to up the stakes one more time. What is the need we intend to meet? If it's to oppose threats to human well-being, to address the true causes of disease and injury and disability for everyone, then logic forces us to look even further than the usual list of social determinants of health. It forces, to me, our scrutiny of the very values we embrace or should embrace, and it forces us actively to defend those values. And at last, I think we're starting to recognize the inescapable importance of these social determinants of health. But now I think we need to go one very hard step further. We need to call out not just the social determinants of health, but also the moral determinants of health. Because without that, we are not going to find the will to act. It's not technical. And we can't just gaze, remember. We have to act. In the quality movement, we don't just measure surgical complications, we stop them. We don't just notice medication errors, we stop them. We become experts in, we ought to be very proud of, the thousands of improvement projects in healthcare today, many celebrated here in these past few days in nations all over the world, and we know how it feels when we act. I have to go back to the bright side for a minute. I'm always touched by a photograph I'll show you in a minute taken by our staff in the IHI's 100,000 Lives campaign. That was the National Patient Safety Campaign that we ran 2004 to 2006, which it mobilized 3,100 American hospitals, accounting for 85% of all the hospital beds in America, all about patient safety. It was all volunteerism, all thousands of waiters running up the hill, tens of thousands of Evans waving their magic wands. And one of the fun episodes of the 100,000 Lives campaign was when the young campaign staff at IHI, they decided to rent a bus. They didn't ask me, they just did it. And then they shrink wrapped it with campaign logos, and they drove it across the United States. They made stops in 15 or 20 cities for rallies. They just did that. But when they got to Madison, Wisconsin, there was a rally arranged for them at Camp Randall Stadium, Badger Stadium. They walked into the stadium, and what they saw was a sight that brought them all up short. The hosts, the hospital staffs, the leaders in Madison, Wisconsin, in that area, they had outlined, I think you can see it, the green arrows point to it, they had outlined 1,200 seats in Camp Randall Stadium with yellow balloons. That number, 1,200, was the number of lives they were setting out to save in the area by working on that safety campaign. They promised this. They promised it from their hearts. This is the quality of mercy in Madison, Wisconsin. In researching the Merchant of Venice, I came upon a very interesting fact. There's very little doubt, by the way, that Portia is anti-Semitic in the play. She's an overt racist if you study her lines. But it turns out Shakespeare wasn't. The usual evidence produced for that assertion that Shakespeare was not bigoted is a famous speech by Shylock in The Merchant of Venice. You may know this speech. It says, "Hath not a Jew eyes? Hath not a Jew hands, organs, dimensions, senses, affections, passions, fed with the same food, hurt with the same weapons, subject to the same diseases? healed by the same means, warmed and cooled by the same winter and summer as a Christian is. If you prick us, do we not bleed? But there's actually another, to me, much more interesting fact about Shakespeare that testifies to this contention, even better evidence of his compassion. I'll bet you never heard of the play called The Book of Sir Thomas More. I had not heard about it until a few weeks ago when I was talking with a Shakespeare scholar friend of mine about Portia. This play, The Book of Sir Thomas More, was written sometime between 1591 and 1593, and the original manuscript exists. It's in the British Library. And it is now nearly certain that William Shakespeare was one of the authors. What probably happened is that he was called in to rescue a play that in general is pretty bad. But 3 pages in the British Library manuscript, they are in Shakespeare's own handwriting. This is the only 3 pages known to exist of a manuscript in Shakespeare's own hand. The scene Shakespeare was writing into this play, it was a speech by Sir Thomas More to an anti-immigrant crowd in London in 1517. In Thomas More's time, Londoners were rioting against job losses that they were blaming on immigrants from continental Europe. They're taking our jobs away, they said. Shakespeare's words, though, were clever. They were echoing quite intentionally in riots that were occurring in his own time, a century later, against Huguenot refugees in London who were taking our jobs away. And he places in Thomas More's mouth words that chastise the rioters. He warns them that when prejudice and xenophobia hold sway, when mercy dies, they themselves could be next. He's saying what goes around comes around. I'll read you what was said. And I must say, Raj Punjabi came to mind this morning again. Here's Shakespeare's words. Imagine that you see the wretched strangers, their babies at their backs, and their poor luggage, plodding to the ports and coasts for transportation, and that you sit as kings in your desires, authority quite silent by your brawl, and you in ruff of your opinions clothed. What had you got? I'll tell you. You had taught how insolence and strong hand should prevail, how order should be quelled, and by this pattern, not one of you should live an aged man. For other ruffians, as their fancies wrought with the self-same hand, self-reasons, and self-right, would shark on you. And men, like ravenous fishes, would feed on one another. Other ruffians would shark on you, he warns. What goes around comes around. Nothing so impresses me so reliably or so movingly or so often as the generosity of our colleagues in healthcare when they are invited to help make things better. With the encouragement of their leaders and a small dose of improvement methods, as you see here through this marvelous forum, they make magic happen over and over again. And by the way, unlike Evan, their breadstick wands work. So here's what I ask of you. Could we bring that magic to social justice itself? Could we as a community choose to use our own solidarity, our own expertise, our own purpose to restore in this parched landscape mercy, love, as a community, as a nation? I propose, with some trepidation, a new campaign for our quality movement, founded on a shared commitment to act on what really matters to the people of our nation, to all the people of the world, boundaries notwithstanding. There's a long, long list of wrongs that we could try to set right. I'm going to try to make a start here, but I want to detour to make one wonky point about the language that I'm offering now. For me, the idea of the moral determinants of health means exactly the values that we decide, that we choose, will be the foundations of our aims, of our policies, of our investments. Reliable moral determinants are, to me, emotions, much as Martha Nussbaum, the philosopher, seems to Council. And the relevant emotions are these: compassion, kindness, a sense of togetherness, a sense of human solidarity, love, and mercy. The campaign that I would envision would consist of those actions, those goals, those investments that moral compass points to. They are what we must work on, or must choose to work on, if we're going to be true to that moral core. Our project then becomes to improve the social determinants of health that our moral determinants illuminate. So I'm not suggesting this is right, but if we were to do such a campaign, I would think of 7 elements for starters. Some may surprise you. First, declare commitment. Achieve U.S. ratification of key human rights treaties. Technically, so the U.S. technically has ratified the Universal Declaration of Human Rights, but we have not ratified subsequent covenants or treaties, especially pertaining to the right to health and health care. Most notably, Congress has not ratified the International Covenant on Economic, Social, and Cultural Rights. President Carter signed it in 1977, but Congress has not ratified it. We have not declared as a nation a commitment to health care as a human right. This covenant focuses on the right of all human beings, not just Americans, to food and shelter and education and health. This covenant, along with the Universal Declaration of Human Rights, the International Covenant on Civil and Political Rights, which we did ratify in 1992, they make up the Human Rights Commission's internal Bill of Human Rights. We have also not ratified these other key human rights treaties. The Convention on the Elimination of All Forms of Discrimination Against Women, we have not ratified it. The Convention on Rights of the Child, we have not ratified it. The International Convention on the Protection of the Rights of All Migrant Workers and members of their families, we have not ratified. And the Convention on the Rights of Persons with Disability, we have not ratified. We need to join the global human rights community formally and now. And as part of that commitment, we'll call one out in particular, which is to make healthcare unequivocally a human right in this nation. I want to call out, again, a special credit to Dr. Stapimetti, who has educated me about this human rights frame. But in this case, our country, at this moment, still has 30 million people without health insurance. 30 million. Enough dancing around that. Enough. It is time to end that cruel embarrassment. This quality movement should stand foursquare, vocally, for universal health coverage in the United States of America now. I would consider any policy that makes that happen, but none that don't. Third, we need to restore American leadership to the fight to reverse climate change. My 7 grandchildren, they are inheriting a planet which we have brought to the brink of destruction. To channel Greta Thunberg, shame on us. The evidence is overwhelming. Our nation is not doing its job to reverse that imminent tragedy. It may be too late, I fear, but we have to try. And it's not just the ultimate risk to the planet. This is about health. The misery en route is massive. As rising seas flood Calcutta or Ho Chi Minh City and all of Bangladesh, think what's going to happen to the refugee situation in the world. It will dwarf the refugee crisis we have, which is a health crisis. Think under John Rawls' veil of ignorance about the end of drinking water in South Asia, or when most of the Himalayan glaciers have melted. Think about New Delhi, maybe Phoenix, becoming too hot to live in. Think about the assault on global order, the climate wars we are already facing when these things come to pass. Neither health, care, nor the quality movement can responsibly be a bystander. Fourth, please, let's achieve radical reform in our nation's criminal justice system. We have more people in prison per capita in this nation than any other nation on earth except Russia. And the people who are incarcerated are overwhelmingly people of color, by a factor of 6 or 8. This is the cruelest form of racism in our nation in our time. It is the direct descendant. It is today's form of slavery, of lynching, of segregation. We know the remedies. They are among them constructive alternatives to incarceration, compassionate investments in human development for people who are incarcerated, and effective programs of support for reentry into citizenship and productive participation in society, and productive lives for people returning from incarceration. Our broken criminal justice system, it is a plague, it is an epidemic. It is as erosive of health and well-being for entire generations as the most toxic bacterium or the most sinister cancer. We have to fix it. Fifth, we've got to end policies of exclusion and achieve meaningful immigration reform in this nation. I have had it up to here with cruelty at our borders. I have no doubt at all that we need and we can navigate toward compassionate and effective immigration policies in our nation. But read Martha Nussbaum. All of the core emotions that sustain a decent society have their roots in or are forms of love. Fear-mongering, cramped cells, family separation, and violence are not the mechanisms of a civilized society. They are not the mechanisms of a caring society, of a merciful society. These are human beings, and we have a duty to heal them too. Or I warn you, other ruffians will shark on us. Sixth, we need to end hunger and homelessness in our nation. We have hunger and homelessness in America that ought to offend every sensibility of a civilized and compassionate people. The claim that our rich nation cannot assure food and clothing and shelter to absolutely everyone. Indeed, I would say a decent standard of living to absolutely everyone. For every single child in the US, that claim is just not credible. That claim is insane. 114,000 homeless kids in New York City within sight of Wall Street is just a matter of will. And let me be clear, this absolutely requires a big dose of redistribution of wealth in America. It requires that we willingly and proudly help through progressive social and economic policies those who suffer from deprivation of whatever cause. It means once and for all ending the practice of blaming people who are less fortunate. A forum speaker of last year, Father Greg Boyle, has said, here is what we seek: a compassion that can stand in awe at what the poor have to carry, rather than stand in judgment as to how they carry it. John Rawls gave us the formula on what Martha Nussbaum calls the 20th century's greatest work of political philosophy, Rawls's 1971 book, A Theory of Justice. And in Nussbaum's words, Rawls asserts that in a well-ordered society, inequalities of wealth and income will be permitted only when they improve the situation of the worst off. Finally, and seventh, I think we need to restore order and dignity and equity to our democratic institutions, and most of all, assure the right of every single person's vote to count equally in this country. When the institutions no longer serve mercy and compassion and health and shared well-being, the rules must change. And I believe deeply that America's project in democracy, however fragile, however sometimes wandering or even maddening it can become, it's still the best route to the communities that we want. I trust that waiter running up the hill to do good. I trust Evans instincts. Surely the righteous are among us even now. And so woe to those who would tamper with our democratic fiber, who would erode the foundations of equality and voice in our electoral system, who would equate money with power and then celebrate that false equation. When I was about to leave for Washington, D.C. To serve in the Obama administration, my son, Dan, he gave me a quiz. He said, "Dad, pop quiz." He said, "What's the most important law that we could pass in this country to improve the health and health care of our nation?" So I fumbled. I didn't know the answer. He gave me the answer. He said, "Dad, it's campaign finance reform." And he was absolutely right. So look, you sit there, you're generously listening to me. You may be a nurse on a hospital ward, a pharmacist, a primary care doctor, a neurosurgeon, a quality manager, finance director, board member, CEO, patient. You may be a student. Maybe you are a public official somewhere, and you're thinking, has Don gone crazy? I mean, does he actually expect me to stop global warming, to end hunger? Does he expect me to reform a dreadful criminal justice system? Does he expect me to restore one person, one vote democracy in America? And the answer, my friend, or maybe my former friend, is yes, I do. I do it exactly the same way that for 30 years, I've had the privilege of calling on you to join in this magnificent global quality improvement movement that we've together made. It's in just the same way. You cannot each alone make healthcare better. It's too complicated. It's too dense. But as you have so well shown in these decades and illustrate so beautifully at this meeting, what you cannot do separately, you can accomplish together as a unified force in your departments, in your organizations, in your communities, and in your nation. You can save lives, and you have already done that. So now let's rescue our values. That saves lives too. As individuals, you each have 4 actions. They're readily available to you. They are to speak, to write, to work, and to vote. I offer you my list of the 7 arenas for moral action. Every one of them counts. You can speak of them continually from now on, wherever you are. Your voice matters. In healthcare, your voice really matters. Even more speaking together than separately. You can write about them in any venue you can find, in an op-ed, in social media. You can work on them, because somewhere, I guarantee, in your town or your city, there are already people, there are already organizations trying to help formerly incarcerated people find a decent life, or welcoming immigrants, or assuring voting rights, or opposing gerrymandering, or fighting for local ordinances and behaviors on environmental sustainability. You'll find organizations that are feeding and housing and clothing people. You can find them and you can join them. Or you can start work if it's missing. And above all, number 1, much more important than the other 3, vote, turn out, vote for the kind of society you want. Our biggest enemy in getting back to a moral nation is voting turnout. You can test the guiding principle of a veil of ignorance and love and policy before you pull the voting lever. But most importantly, you show up, and I'd like you to commit right now maybe to getting 5 other people to vote who otherwise might not. That'll change everything. For those of you who help lead organizations, please inspect and then change your business model to better align with the moral determinants of health. For your workforce, you can guarantee a local living wage that's sufficient for a full and dignified life. You can identify forthrightly and courageously all forms of structural racism and discrimination within your walls and end them. You can commit to carbon neutrality by 2040. That's a real goal. You can get involved as a matter of corporate policy and programs with people at risk of or already involved in the criminal justice system in your community to reach out and help the previously incarcerated. Help set and achieve community-wide goals for eliminating food insecurity, homelessness, and failing investments in education. I'll just mention, IHI has joined with Community Solutions, working now with 84 communities in the US trying to end homelessness. It will expand in 2020. 11 communities already have ended either veteran or chronic homelessness, 11 of the 84. You can join now, so contact Nignon. You can contact Nignon Lewis, nlewis@ihi.org, if Nignon won't be too angry at me for giving your email out, but she can help you get connected. Get connected. Support voter turnout. You work at the roots of despair in your communities, not just at the consequences. So look, I'm quite serious about my proposed list of 7 arenas for improvement, which are motivated by, commanded by, our choice of the moral determinants of health. This isn't, by the way, I'm not saying this is a for example list. It's a specific, intentional agenda. It defines a campaign worthy of our community and at the heart of our mission. Join the human rights community, make healthcare a human right in America, restore American leadership on climate change, reconstruct a compassionate and healing criminal justice system, connect immigration policy to decency, inclusion, and compassion, end hunger and homelessness, period, and restore democratic institutions, above all, secure the right to vote. Let's do this. I want us to become agents of change and improvement, to restore moral force in a compassionate and merciful world. Frankly, it's the only route to success that I can any longer see. I think it may be the only route to survival. You know, the quality of mercy droppeth not as a gentle rain from heaven. It requires hard work, tenacious love, and fierce defenders. And my friends, if not us, who? And if not now, when? Thank you.